Let's talk about cervical incompetence, otherwise call it cervical insufficiency on ultrasound, and let's define what cervical incompetence is. This occurs when the weak cervical tissue causes or contributes to premature birth or the loss of an otherwise healthy pregnancy. A uterus is made in such a way that there is a part called the lower uterine segment, and this part called the lower uterine segment is what we call a cervix. The cervix is made in such a way that there is the internal cervical os and the external cervical os. And what happens is during cervical incompetence, the cervix just opens and releases the products of conception, releases the baby who is developing in the womb, otherwise making a mother to have a miscarriage. What are some of the symptoms, some signs and symptoms of this? This could range from low abdominal pain or bleeding. And again, we could just have a miscarriage with no pain, just a spontaneous miscarriage. Sometimes when the mothers come to the hospital, they could be complaining of the pain, or sometimes they'll come to the hospital when the miscarriage has already happened. And what we do on ultrasound scanning is, once we receive these mothers complaining of these symptoms, we will do, most of the time you'll be told to do a scan. And what do we do on a scan? We just focus on two major issues on the cervix. One, we'll want to measure the distance between the internal and the cervical os. The internal cervical os opens inside the uterus. The external cervical os is on the outer side of the cervix. So we want to measure the two distance to make sure that the distance is sufficient enough to carry a pregnancy up to term. The next thing that we want to look at the internal cervical os to make sure that there is no opening, or otherwise there is no funneling of the internal cervical os. So when we do an ultrasound, these are the two major issues that we are looking at. If we find out that the distance between the internal and the cervical os is not sufficient enough to carry the pregnancy to term, we will communicate this to your medical team so that at least a medical intervention can be administered to help you or to help the mother carry the pregnancy to term. If we find out also that there is funneling of this opening of the internal cervical os, we will communicate the same information to the medical team that is handling the mother, so that at least, again, a medical intervention can be done, so that at least we can help the mother carry the pregnancy to term. This occurs between the 12th week and the 20th week of pregnancy, and is the time where we can do accurate diagnosis of cervical incompetence. So once again, if you have this problem where you have a pregnancy and always you have a miscarriage that cannot be explained, kindly come to the hospital between this period. Visit your healthcare so that at least a scan can be done, because I'm sure if we do a scan at this particular period, we might be able to find out what exactly is happening. And maybe if it's cervical incompetence, then a solution can be found. What I've always said is, God has given us this technology to improve the quality of life of our brothers and our sisters, and He has given us this technology in our hands so that He can use us even to do what He wants to do on the face of the earth, and that is just reaching out to His people. I've always said that once we do this examination, once we use these tools, I'm sure that actually everything is going to be fine, and you'll be proud to have a baby even after 9 months. You'll be a proud mother. I believe and I'm sure that it's not always in vain, it's not always finished. There's always a light at the end of the tunnel. So if you have had these issues, kindly visit your healthcare, have a scan, have an ultrasound scanning done, and I'm sure that at least you might or you will get a solution to your problem. Thank you very much, and have a great day ahead.